Welcome back. Now, doctors in India say the first hurdle in their attempt to separate conjoined twins has been cleared. The surgery on Monday lasted 22 hours and concentrated on the brain. The twins, who are just over 2, are still joined at the head. Well, Professor Deepak Gupta from the All India Institute of Medical Sciences is the paediatric neurosurgeon leading the medical team. He's there in Delhi for us. Thank you so much for being here on the programme. The obvious question, first of all, how are the twins doing?
The twins are doing very well. In fact, today morning they have been extubated. They are conscious, obeying commands, and they are in good shape as before.
Tell me a little more about the surgery itself, just how difficult it was.
Well, we had done adequate planning for the surgery. The kids came to us and they had a shared venous sinus, and that is the problem of separation. Normally we need to end up sacrificing one of the child, and so in this case, after having reviewed the literature, national and international, we decided that we should make an attempt to save both the children. So what we have done is we have done a venous bypass. We have constructed a new conduit for both the kids, and so that both the kids have their independent venous drainage. So it was a pretty complex operation, and to the best of my knowledge, it's not described in the literature. It's working well. We got a CT scan done yesterday for the kids, and the CT scan is normal. The kids are doing well.
That is great to hear. I mean, twins like this are very, very rare. Most die extremely quickly, so at just over 2 years old, they've already defied the odds, haven't they?
Yes, true.
And tell me a little more about what you actually said to their parents, what you said to them about the chances of success with this operation.
Well, I did tell them that the surgical separation procedure carries itself a very, very high risk. The mortality can go up to as high as 60 to 80%. But the parents who came from a very far off area from India, they have come up with a lot of expectations to All India Institute of Medical Sciences, which is looked upon as the best center in the country. And they were prepared for anything happening to one or both the twins. They had faith in us. However, yes, I knew at the back of my mind that whatever surgical procedure I'm going to do to these children, they will have very high risk with the procedure, but everything has gone on well, at least in the first stage of the surgery.
It must be an extraordinary moment. I said there in the introduction, 22 hours of surgery for you and your team to delicately have to work for hours at a time standing up. When will you attempt the final separation?
Well, we have presently put in the skin expanders. As soon as our plastic and reconstructive surgeons say that the kids have got adequate skin to cover the defect, I will be ready. Usually it takes on an average